Well, we've been talking about periodontal disease, and joining us in our newsroom this morning is Dr. Kris Tumilowicz. Hi, Dr. T. How are you?
Hi, good morning, everybody.
Good morning to you, too. Now, kind of following along, talking about periodontal disease and kind of the next step in the next procedure to this.
What does that mean, periodontal, do you think?
Periodontal.
Dental, that's Greek for teeth.
Okay.
Perio, around.
Infection.
360 degrees around your tooth. So a periodontist is a specialist that takes care of gum disease. And most general dentists now will help you with gum disease. And most of our treatments are what we call non-surgical treatment. So that means, you don't have to have a scalpel, you don't have to have incisions, you don't have to have stitches. So the initial treatment is usually what we call non-surgical, most oftentimes done with ultrasonic devices. And then the hygienist meticulously cleans underneath the gum line all the way around each and every tooth. And some people will call that a deep cleaning, or gum treatment. And typically we'll use local anesthetic for that, so your teeth and your gums will be numb for that particular treatment. And you may do like maybe 1/4 of your mouth at a time, or maybe half of your mouth at a time. Some patients choose to be sedated. Maybe they want to be asleep for that procedure. They may decide to do the whole mouth all in one single treatment. So that gum treatment is probably the most important part of your comprehensive dental treatment plan, because if your gums aren't healthy, it doesn't make any difference how straight your teeth are, how white they are. You really want to get rid of all that infection around the teeth, and that means cleaning under the gum line to get rid of all that plaque, all that tartar. And as we're doing that scaling, that root planing, that means getting all those endotoxins out from underneath the gum line. So we like to use numbing agents, so that could be a local anesthetic, and we'll even place chemotherapeutic agents underneath the gum line, and they could include things like fluoride, chlorhexidine. Sometimes we'll even place time-release agents underneath the gum line, so that over a week or two, as that medicine, that chemistry dissolves, it actually disinfects and makes the gums healthier. So the whole idea is to get those gums kind of tight around the teeth, no more red, swollen, puffy gums,
right.
Nice pink coral-colored tissue. It's sort of like the stippling on an orange peel. You want to have your gums nice and healthy. Remember that healthy gums don't bleed. So if you're flossing, if you're brushing, and your toothbrush is pink, if you're getting that little bit of exudate, that little creepy stuff around your teeth and gums, that means you're not really healthy. It means you need to see your dentist, your dental hygienist. And most of our periodontal patients will get their teeth cleaned about every 3 months.
Okay.
So 4 times a year, they'll just routinely get their teeth cleaned, so that way they don't have to go through that gum treatment again.
Right. Gums play a huge part in a lot of things.
Next week, we call that periodontal maintenance, where you're getting your teeth taken care of maybe 4 or 5 times a year.
All right. Well, great advice, as always, Dr. T. Appreciate it.
There you go.
If you want some more information, of course, Dental Dimensions there, 1619 North Alpine Road in Rockford, 815-229-3520, or easydentaldimensions.com. We'll see you next week.
Stay warm, everybody.
You too. Well, we'll be right back with much more of 13 News Today in high definition. We'll be doing our